Assalamu alaikum, Great Communication Day. The scenario, Mr. Jack Adam, 45 years, recently diagnosed as hepatitis B positive virus. After having attacks of abdominal discomfort and jaundice, the consultant decided to start him on Tenofavir. Your role is the senior house officer in the gastro clinic. Your task is to sit with Mr. Jack, explain the need of this medication for his condition, and address his own concerns. You can start now.
Hello there.
Yes, hello.
My name is Dr. Ahmed, one of the leading doctors in the clinic today. May I confirm that you are Mr. Jack Adam, 45 years?
Yes, I am.
Mr. Jack, we are here today to discuss some issues related to your health. Is it okay with you?
Yes, sure.
Just to be in the same page, can you please tell me how much you know about your health status?
Doctor, from the last 1 month, I'm feeling unwell, doctor. And my wife told me there is some yellow in your eyes, and I went to my GP. My GP, he's referred me to your clinic, and I did some scans and some blood tests, and I don't know what's ongoing, doctor.
Okay, I'm sorry about what you have been through, Mr. Jack. I am here to help you. Do you have any
Please, doctor,
expectation what could
yes.
be behind? What do you have any
Yeah,
expectation could be behind these symptoms?
doctor, I'm worried about cancer. This is the most uh, worrying thing for me. Is it cancer, doctor?
Well, Mr. Jack, the result of the result of your test and a scanning of your tummy, it's released and in my hand now, and I'm afraid to say that it's not like we hope.
Is it cancer, doctor? I expect a cancer. Oh my God.
No, it is not a cancer at all. This your test results show that you have a condition called hepatitis B. I'm
What,
sorry for that.
what, doctor? What hepatitis? I don't understand, doctor. What you mean by hepatitis B?
Okay, let me to explain to you. It's a medical condition in which it is a virus or a bug infection affecting your liver. Do you want me to explain more about this hepatitis B virus, Mr. Jack?
Okay, doctor, but I want to know, doctor, is it curable one? Will I be fine, doctor? Will I die? Will I have cancer? Please, doctor, answer all this.
Okay, Mr. Jack, if you allow me, I will try to explain everything to you, and then I will address all your concern.
Okay.
Okay, actually, hepatitis B virus, it is a type of bug infection. I mean, it's affecting your liver. Sometimes, due to this, it's attacking your liver and cause damage to your liver. I'm sorry for that, and give you the symptoms like in your case. I mean, abdominal discomfort and this yellowish of your eyeball, and this hepatitis B, it is not curable per se. However, we have a medicine that can control this disease and prevent to progress for another stage. I'm so sorry to tell you that, Mr. Jack. If not treated, hepatitis B can cause cancer and can cause scarring of your liver. However, I want to assure you that that is why our consultant decided to start a new medicine called Tenofavir to prevent this bad effect of this virus to happen, including the cancer. Am I clear so far?
Yeah, doctor, a lot of information. And I just want to know, doctor, is it curable thing?
Hepatitis, this disease is not curable 100%. However, we have a medicine can control these symptoms and can prevent the progression for further stage, like causing scarring and developing to cancer. I'm so
Yes,
sorry to
please
tell you that.
give me this medicine, doctor. I want to be fine.
Okay, so this medicine called tenofovir, actually it is given, it came in oral tablets taken once per day. Okay, are you following
Okay.
me?
Yeah, doctor. Go ahead. Yes.
Okay, we need this medicine to we need this medicine to prevent progression. I mean, developing of more serious effect because of this virus of affecting your liver. And this medicine taken by orally and usually taken after meal. Regarding, and as you know, Mr. Jack, every medicine has a side effect.
Yeah.
Are you following me?
Yeah, doctor. Tell me what expected to have after this medicine. Is it something serious to happen?
Mm-hmm, mm-hmm. Okay. One of these bad effect of this medicine is like sometimes can cause I mean tummy feeling sick. Sometimes can cause throwing up. Sometimes this medicine might affect your kidney. However, I want to assure you this side effect is minimal, and we will keep you on our eyes. We will keep you on follow up, and with regular follow up. uh, and we also this medicine will given in a just controlled dose. That means it is enough for to treating your disease. Are you? I'm clear so far.
Yeah, doctor. Yeah. Okay. Go ahead.
Okay. Okay. This medicine sometimes can affect, can rarely, I mean, can cause thinning of your bone. However, again, we will give you supplements to, and we will to protect your bone, and we will keep you on follow up. and and this medicine, if we compare the benefit and the risk, the benefit is far away to this for this benefit, because it is crucial. I mean, it is important in you protect your liver for more damage. I hope you
Okay.
understand this point, Mr.
Yes,
Jack.
doctor. Yes.
Okay. Do you have any concern until now?
No, doctor. It's clear now, doctor. Yes.
Well, okay, Mr. Jack, if you are you well, can I ask you some social question?
Yes, doctor.
Do you smoke?
Mm, not too much, doctor. Only 5 cigarettes per day.
Okay, even the small amount of smoking might bad effect in your health. That's why I advise you to stop smoking. And if you would like, I will refer you to smoking cessation clinic.
Okay, doctor. Thank you.
Do you drink alcohol?
Yes, doctor. I am.
How many pints per week?
I guess it's maybe around 2 glasses at the weekend.
Okay, Mr. Jack, as your this virus affecting your liver, even the small amount of this of alcohol might cause more damage to your liver. At the same time, sometimes and this that is why I highly advise you to stop alcohol.
Okay,
How's
doctor.
this sound for you, Mr. Jack?
Yeah, I will try, doctor. How you can help me in this?
Okay, and if would like, there is a specialized center. I would refer you to this specialized center to help you in this regard.
Okay, 2 minutes left.
Okay, what do you for living?
Yes, doctor. I am a tattoo maker. I work with the tattoo show.
Mm-hmm. Mm-hmm. Okay, Mr. Jack, this virus actually can be transmitted through the fluids, and can be transmitted through the blood and the other body fluids. And actually, one of these, the way of transmission from person to person through the tattooing. So for now, Mr. Jack, I highly advise you to take precautions, and because this might put the other in danger.
Okay, doctor.
Okay, and if you would, and this in this regard, we will contact and discuss this problem with social worker to see how they help us in this regard.
Okay, doctor.
Are you clear? Am I clear so far?
Yes, doctor.
Okay. Are you married?
Yes, I have my partner.
Well, Mr. Jack, actually, this disease, as we have discussed, can be transmitted through the blood fluid, body fluid, and even can be transmitted by sexual and by intimate relationship. That is why I need you for now to do protected sex and to inform your partner about this problem.
Doctor, please don't tell her. She will be away from me.
I highly appreciate your concern, Mr. Jack. Yes, if this okay, regarding this, I highly advise you to just talk with her, might be even be support to you, and uh, and that is why if you need any help from us to arrange a meeting, if you would like, if you
Okay,
allow to us, you are
okay,
we can help you in this regard.
okay. Time is up.
Okay, thank you for talking to me.
Yeah, thank you. Well done, Doctor Abdul. What do you think? It's long scenario,
Uh,
right? It's counseling
yes,
the disease and the result, and
yes,
also for the medication, counsel about medication. But I think you cover most of the points, and also the counsel about the precaution. But it much be better if you can shorten the time of explanation because you have a lot of concerns.
yes.
Yeah, and also for the red flags and for precaution of side effects, you mentioned it. But you lost the or you missed the interaction, drug-drug interaction. You explained the route of the medication, the possible side effect, which is, as you said, some rash, some GI upset or tummy discomfort. All this is important. However, you have to monitor, as you said, some of the renal function or kidney function, and we'll put our eyes on you
Mhm.
because of possibility if there is change of the kidney function should be monitored its medication as its renal excretion. Then you talk about hepatitis B as mode of transmission. It's okay to mention it as a precaution with the wife. Okay, let's go to the score if we will speak about the clinical communication in this scenario. I guess you cover most of the point here, social and alcohol also give advice, the counseling, sympathy, empathy, breaking bad news, and the control of the disease, yes, as you said. But is it a good controllable disease, do you think? There is, right?
Yes, especially with the new drugs.
Yeah, with Tenofavir, yes. So
Mhm.
you can give him some hope. It will not be false hope because it's one of, according, of course, according to the viral load. But with the follow-up, with the compliance, you have to also to talk about compliance to the medication. He should take it regularly,
Mm, okay.
yeah, in the regular way without missing any dose. And I think the clinical communication, it will be okay, satisfactory for
Mm.
the judgment as well. I think also you can get if Dr. Mahmoud here, he will give you borderline. Yes, I think so. But for me, it's okay. You cover the topic well. I feel you are confident. Concern and welfare also, I think when you give him
I
advice
have
about protected sex, yes, it's okay. Yeah, donation also, I think it need to be offered here, not to donate blood because of the same problem. Anyway, they will
Yes.
screen him. Okay. For me, I can give you borderline in one scale only, either clinical judgment or clinical communication. But the concern welfare, you cover all of them well. Let's hear Dr. Azhar. Yes, Dr. Azhar. Sorry for.
I have little bus.
Yes, yes,
Well
go
done,
ahead.
Abdul Mani. As we
Yes.
already have mentioned that if there is any communicable scenario disease, we will
Yes.
use the RINS, RINS. Number one, R mean reassurance. as we will give him some hope that with the new medicine, it is well controllable. Isolation, in this case, there is no need for isolation and mean notifiable. We have to notify to the higher authority. As means screening of the contacts, because not only wife, all family members we have to screen, and if they are not taken the this hepatitis vaccine, they should be immune. So we want to add this only this things. Otherwise, everything was okay.
Okay, thank you.
Hepatitis is a notifiable disease? I'll ask
Yeah,
Dr.
it's a
Sarah.
notifiable disease. In Saudi Arabia, it is a notifiable disease.
Okay.
للاسف يا دكتور باسم كله نوتيفايبل ديزيز هيباتيتس بي
Hepatitis
وسي
B, okay.
وسي نوتيفايبل ديزيز
And HIV is not.
No, HIV is not removed from
Subhanallah.
the list.
Yes, I know.
Hmm.
Which is very weird. HIV not to be notified, and hepatitis B and hepatitis C to be notified. Anyway, well done. Any comment else?
Yes,
Yes.
regarding the job, yeah, Dr. Basim, should I refer him from the job, or
He's not the one receiving tattoo, he's the one doing the tattooing. But at least, yes, you can give him some education that he should have precaution with others.
okay?
For the hepatitis B, it is a complex case because some patient will be cured
Yes.
treatment from the hepatitis B, but usually some of the patient with the treatment, when the hepatitis B surface antigen is disappearing, it means that they are cured, but it's very less percentage. Okay, he should have the treatment and follow it, and I think when hepatitis E antigen negative after negative after 3 years of treatment, he might stop it. So for the hepatitis B, the treatment will continue, but they will follow him with the hepatitis surface antigen. They will check it, and also they will do for him fibroscan every 6 months and alpha fetoprotein every 6 months for surveillance, prevent
For
cancer.
cancer, yes.
This is my knowledge about it.
Or we can say, okay, as we say, it is controllable. We can say this disease behaves in different people differently.
Yes.
In some, the antigen disappears, so it means the person can be curable from this disease. And but in majority of patients, it around about 85%, the surface antigen persist. So in mostly cases, antigen persist. So in that case, with the medicine, with the new drug, we can have control. We can control the disease with good results. This could be added in the description.
So what we will say that we'll give him an antiviral medication against this virus, so it will suppress the virus, prevent further damage to your liver, and it might decrease the virus to a very low level so that it won't affect your liver. And we'll follow you regularly with some blood test and scan to make sure that your condition is not progressing. So we'll make it like this.
Yes, I think it's preferred to say he's scarring of the liver, right? Because it's fibrosis and
Sorry.
it's the type of damage here, I mean. So your liver will be scared or scarred, like damaged by scarring, right?
Dr. Was any specific side effect of tenofovir? But only it will affect the kidney and bone. This is
And
specific.
drowsiness, yeah.
Important things, kidney and bone. Sometimes
yeah, go ahead.
And the normal, any drug, you should say the side effect: nausea, vomiting, dizziness, abdominal discomfort, sometimes allergic reaction, and then
Skin reaction.
they're usually the osteoporosis and monitor the renal function. And insomnia, that's why we advise them to take the medication in the morning.
In the
morning.
In the morning, it causes insomnia.
Sometimes it causes insomnia with some patients.
Thank you.
And it's tablet. You're taking one tablet in the morning.
So it's better to take in the morning because cause insomnia. Okay.
I preferred if you don't know the timing, better to mention. We will include our pharmacist. They will sit with you and they can give you more education about this medication. However, if you are sure, you can say it. But
what is the drug, Dr. Basim? What is the drug?
Tenofavir.
Is it Tenofavir or Tenofavir for hepatitis B?
Tenofavir. Yes. And
Tenofavir.
also, no, Entecavir for HIV.
HIV.
No.
Tenofovir.
Tenofovir also used for hepatitis B.
Both of them for HIV, but
Yes, we are giving it. It's one of the one medication called Truvada. It contains tenofovir. So for patients have co-infection, hepatitis B and HIV, we are giving the Truvada because it suppresses both virus.
Mm-hmm.
Because
But-
Truvada contains tenofovir.
For hepatitis B alone, Entecavir, I think.
And Entecavir sometimes is giving tenofovir also. But in this scenario, it's tenofovir.
Given. It's already given. Mentioned in the scenario? I don't know. I didn't read the scenario. Is it written in the scenario?
Yes.
yes.
Okay.
Okay, I share the side effect of. So if you start with side effect of new medication for you, I mean, first time to face it in the exam, I mean, you can just mention the GI upset and some allergic reaction if you are not aware about specific or the medication. Don't be panic. You can mention
The
this.
other issue, I think, he should, if his partner doesn't have the infection and has full vaccination and have antibody more than 100, so she won't have the infection. Because when you are taking the vaccine for hepatitis B, when you are taking the vaccine, they said this vaccine prevents you from having the infection. So I think if his partner is fully immunized and have good response, one of the good responders to the hepatitis B, she won't get the infection, right?
Yes,
Yes.
I agree, but to go deep to these details, I think,
What we check, we need to check your partner, check her, she's vaccinated or not,
yeah, her level of immunization, yes, exactly.
or not, and finish.
The same of HIV screening. When the patient have HIV needle stick, you are screening for hepatitis B immunity state. But it will not go deep to this
Yeah.
extent of
But
information.
actually, Dr. Batman, this is the first time to know that hepatitis B and C is not a viable disease.
Yeah. By the way, I brought this scenario because it came recently. I think the previous diet in Egypt. So
Okay.
we might face this scenario.
Yeah.
I'm trying to make modified and change of the scenarios because we repeated a lot of scenarios. But Tenofavir this first time to speak about it. I hope it will be helpful for others. Just not to be panic whenever you face new medication, you didn't prepare it. We know about monoclonal or biological therapy. We know how to manage and how to deal with this scenario. We know about methotrexate. We know about DMARS and DMAMS for multiple sclerosis and
And
rheumatoid
recently,
arthritis.
NOACT appeared recently, I think.
NOAC,
Apixaban.
warfarin. So don't panic and put some point to talk about. For example, drug-drug interaction, very important in any medication. You can put it and you can tell him, please don't take any medication unless you have prescribed by your GP. Or you can seek medical advice, for example, because you are taking some medication which might have interaction with others. This advice you can give it to any medication, especially the warfarin, because the warfarin have a lot of drug-drug interaction, plus the diet, of course. So this is the way how to talk. As you said, frequency, the route, oral or IV or subcutaneous, the indication, of course, according to the diagnosis, and the side effects, as you talk about either general or specific. If you don't know the specific, just talk about the general. And if you feel you can give general advice for the future. If you have faced or you feel unwell, you are feeling different than before, please call us or seek medical advice or go to your GP. You don't know what will happen with this medication, right? Even it's not known the complication, I mean. But if you know, you can specify the side effect. For example, rash. Please, if you notice some rash in your body, either observe it or seek medical advice for it. If you notice yourself is not feeling well, if you fall down, All these things you can make it as general. If you feel yourself unwell, don't hesitate to call your GP or to seek medical advice. However, if it is one of the complications, you have to just alarm him. Please have rest these days. It might feel dizzy. Take it in the morning. Driving related to drowsiness, like amitriptyline scenario. You have to talk about the driving if the patient feel drowsy. Okay, and also the same advice. You can take it. You can take the medication in the early morning, or for amitriptyline before sleep. But for tenofavir, as Dr. Sarah said, you can take it early morning if you feel drowsy. But I think the opposite, Dr. Sarah. If it's drowsiness, so he better to take it before sleep.
But it's not a common side effect. The insomnia is more common. Usually they are coming saying, because we are giving this with HIV, they said, I'm not sleeping well. So according to which side effects they are facing, because they are not facing both side effects. According to
Okay.
the fact that he reports, so you can take it in the morning. But from the beginning, we are giving most of the antiretroviral medication we are giving in the morning.
Okay.
The other issue regarding the notifiable, acute hepatitis B and E and C are notifiable, only the acute, not the chronic. Okay.
Okay. Yes. Okay. Thank you, Dr. Sarah. I will read the comments quickly. Dr. Aisha said, other points to cover for how long medication took. I think this point better not to explain or to raise it.
We'll say from months to years. We don't know
Yes.
exactly
Yeah,
what.
it's long time, but you don't know exactly how long. So it needs someone concerned to them, like clinical pharmacist, for example, or gastro. Yes, you are here at the gastro clinic, senior house officer, but you don't know the level of the viral, the response to the medication. So you can say, yes, it's for a long time, but we will follow up you and we will update you every follow-up, just to be safe. The job, yes, we mentioned trace contact. As yes, we mentioned the wife or the if he has other relationships, he should be also advised about. Should we stop him from tattooing, take advice from occupational health? Yeah, I think it's better to refer, and the occupational will take the decision. You are the internal medicine. This is my scenario. Okay. I
By
shared
the way, Dr.
also.
Dr. Basim, in such
Yes.
case, do you expect in such case for tattooing, or they have occupational department? I don't think so.
But at least he will take some education or some instruction how to deal, how to do. But I think they will not prevent his job. He's not the one sharing needles, or he's not doing sharing tools with them. But if you are suspecting the patient will get the tattoo, he should be also instructed about to be safe, to be with the approved center. Not you understand it. This is the way how to deal with it. But anyway, at least give him some advice and instruction about the job.
Okay.
Okay. Hepatitis B in acute setting, there is high chance to recover spontaneously, but in chronic setting, the chance of cure is less. Yes. Is it 100% curable, Dr. Sarah?
Yes, we saw a lot of cases that treating hepatitis
Recovered, yes.
cured spontaneously without treatment. I didn't know that your cases are cured.
Yeah, and I think also they stopped the medication. I saw a lot of patients here.
Some people, their body clears hepatitis B.
Yes, this is what I say. Yeah.
Self-cured.
Yeah, so it's totally curable.
No,
This
I do not agree with this. I do not agree. Totally not. Because the subcentegen only
according to
disappear
the
only
antibody,
15%.
right? According to antibody.
Yes,
It's not curable.
hepatitis C can be cured, but hepatitis B, some people can cure it spontaneously without treatment, and most of the people they have it, but it will be controllable with the medication and cirrhosis.
Okay.
Just one comment.
Yes, go ahead.
Okay. Yeah, I think what you are talking about is chronic hepatitis, right? So treatment with CDF in acute hepatitis most of the time is not recommended unless the patient has encephalopathy or acute liver failure. So this is a watch and wait approach in acute hepatitis. But once the patient has chronic hepatitis with indications, so treatment should be started, but most of the patients would require lifelong. Cure is very rare. Cure means when they lose hepatitis C surface antigen, which is very rare. So most patients will end up in lifelong.
Okay. Thank you, doctor.
Okay, how can I raise the issue of notification and tracing in such patient?
Yeah, we will notify to the high authority about your infection, just to be aware about your disease. That's it. It's one of the notified disease we should inform them about. But don't
And the
worry,
issue
it will be
of tracing.
confidential. Tracing, as you said, who is having contact with you, especially those with, I mean, intimate relationships. So mostly her wife or his wife, and
Okay,
you
close
can give
contact only.
advice, yeah, close contact, and you can give advice if he has other casual relationships, but at least mention protected sex or safe sex if you want to practice sex.
I'm not quite sure that we need to tell the patient it's notifiable or not. I don't know. Can
No,
some,
it's one of the notifiable. I
but
think Dr. Ahmed mentioned, yeah, to mention to him, yes, we are notifying.
but
Yes, before.
it is notified to the public health. But we need to tell the patient that we notify the public health. I think it will be
This is what,
automatically.
for
Not
any point,
knows.
like encephalitis, meningitis, we are notifying and we are telling to the patient
We'll
we are
tell-
notifying.
I think this information should be disclosed.
No, this is autonomy. That's a part of his
Yeah.
disease. Should know everything about his disease.
Okay. For the partner, I think what we'll do, you will tell him that it can be transmitted through blood, through body fluid, as you said, and you need to notify the people who have been in contact with you with such things as sexual partner. If he said no, you can tell him we can help you with the partner notification, which is anonymous notification. So we'll send a text message to the person that you have been in contact with someone at high risk of hepatitis, infected with hepatitis B. Please come to do the blood test without writing the name of the person who has the infection. This is called anonymous partner notification.
Anonymous. Yeah.
We have a system called partner notification by sending text message to someone you have been in contact. Please do this test, even for the HIV. So the partner will not know that he had this infection from him, and he will go to do the test.
Okay.
And help him with that.
Yes. Okay, clear. Thank you, Dr. Sarah.
Now the question arises, the patient, a surrogate says, it is must that I have to inform my partner. Then what should be our response?
Yeah, better to inform.
What we will tell him, yes, you should inform your partner.
Yes.
If your partner had this infection, she won't have the treatment. She will suffer from liver scarring and might get in coma. If you have
Plus the kids.
you don't
Yeah.
want to live without their mother, it's curable condition, so she will lose her opportunity to be cured, and even for the HIV. So at the beginning, you try to say that HIV is curable. We want her to develop to AIDS, which is fatal condition. So we will make him scary, and his wife will lose the opportunity to have the effective treatment that can help her to live healthy lifelong. And if he declined and he said, I don't want her to know, so we can help you by partner notification, by sending anonymous message to your partner to tell her to get tested. And in meanwhile, you should have safe sex with condom. So we try to make all of this.
You can use also the weapon of kids. If you are planning for kids, they will be safe.
Yes.
And they are at risk to get the infection from their mother if she is not.
Yes. This also.
But
It will be convincing.
Regarding the HIV, the latest guideline from the UK is that it is not must to inform the partner unless you are using the protective measure.
Yes, if he said I will have safe sex, Okay, but we'll try as much as we can by offering the complication, by trying to convince him, by offering the partner notification. We'll try to do all of these things, and we as a patient he can accept at the end, and if he's not accept, we'll tell him to have safe sex. But I think most of the patient will accept and will notify the partner.
Yes, at the point of screening, not only to transfer the infection, it's also for screening to treat them because they had already contact with him. It's not a current issue, it's previous issue. He might had a sex with them and he gave already the virus to them.
Yes, and also for the HIV now, it's when the virus become undetectable, it will be untransmissible. So when he will have his viral load will be undetectable, maybe after 3 months of starting the antiviral. So we
Yeah.
explain for him when your virus is undetectable, it means untransmissible. We make it make it like this. So it won't be transmitted to your partner, won't be transmitted to your kids if she's female. So it will help them to disclose and to know that it's treatable. So his wife will have the treatment and will be treated because undetectable, untransmissible.
Okay, thank you, Dr. Sarah and Dr. Azhar. Nice discussion about
بس
this.
بس
Yes.
حضيف شغلة صغيرة.
In
طيب
English, Dr. Hind, please. In English. As you
يا
like, but
حاضر.
in English.
طيب حاضر شغلة مو
Okay.
شغلة. طيب I want to add something very بيتي. تمام. لما قريت السيناريو اللي انتوا كاتبينه، اولا مو واضح اذا هو
قول
يعني هو على
الإنجليش.
الاغلب كرونيك صح؟
still in Arabic, Dr.
Please do
Hind.
not ask in
صح
Arabic.
صح I'm
You
sorry.
will-
when I read the scenario it was like have attack of abdominal discomfort and jaundice. So it is لا حرام, it can be acute. طيب, so acute versus chronic, even though those symptoms can happen whenever you will have an advanced cirrhosis. So in the
Yes.
scenario it is not very clear
Clear.
whether it
Yes,
is
yes, you're
acute
right.
or chronic. Second point, a second point which I want to tell you, ليش نسيت ثواني. about the partner لا طيب not about the partner نسيت شو كنت أحكي. Anyway, try not to assume. Yes, the second point which I want to say, it is not mentioned how he get this hepatitis B,
Yes.
right?
Yes.
So two information are not there in the scenario. And you people made a lot of assumption about those 2 points. First thing, you went into a big details about his sexual life, and you brought the issue of informing the wife and contacts. Between two brackets, you are assuming that the sexual route is the causative is the cause of the infection, صح ولا لا? Even though it might be needle sharing, it might be needle stick, he might be a nurse, صح? It might be from يا حرام يعني it might be accidentally in a dental clinic ولا
Yes,
عنده
it could be.
contact
Yes.
ولا عنده وايف كل هالكلام هذا is not there. So my advice to you, whenever the scenario is vague, there is no transmission method. So first thing, and second thing, it's not written clearly acute or chronic. So I will mention both. تمام, that at this stage we need to do further investigation to determine the state, whether it is acute or it's chronic, and based on that we might notify the public health, تمام, which is an authorized committee, and this notification gonna be anonymously, and they will not know the personal information about your condition. It will help them to trace if they need to trace or to register the cases, لأنه مو دائما بنعمل tracing بالذات لو كانت من dentist مثلا. I will tell all the possibility, either they will trace or they will keep it for their own records, تمام, but it will be anonymous and after informing you, okay, that this committee should be notified. هذا الفرست. فبهالطريقة أنا irrespective of the transmission method, I informed him about the notification, and I didn't say whether it's acute or chronic. هلا لو أنا if I have a data which made it clear for me it's acute or chronic and I know for sure whether I will notify or not, I will go for the available data in my card. If it is not, better not to take the risk and deal with it as a notifiable disease, because most of the time scenarios which we have, it's two type of scenario: either needle stick injury for acute incident, it is not chronic, or it is not notifiable. تمام. يعني you will talk about the prophylaxis more, pregnancy if she's a lady, about job allocation if he is a healthcare professional. Or we will have a chronic patient who came with for example, recently came hepatic encephalopathy, and I don't know what, all the complications, they found out he have hepatitis. So here it's clear for you, it's a chronic. هلا vague scenario like the one you wrote, I'm not sure about, except if someone had it in a mock or copy it from one of the free sessions or one of the courses. Second thing, I want to speak about the transmission. At the same time, I don't have any specific transmission. In this context, you will enumerate. You will not point. ما حتوجه أصابع الاتهام للpatient تبعك. You will not point a specific transmission. You will not pick anything. You will make it very vague. You will enumerate. You will tell him that this type of viruses, it has multiple modes of transmission. One of them is through needles. One of them from the mother to her child. One of them through unsterilized equipment, like the equipment used in the dentistry, or in any procedure, through tattooing. Okay? Then إذا أنت ما شاء الله عليك متمكن, you can ask him, is any of those methods, do you have any idea about any of those methods? Or could you get it through any of those methods يعني? He will be open for you. Or it can be asked في آخر واحدة through intimate relationship. He will, if it is written in his transcript to take you through that pathway, حيمسك واحدة ويقول لك إيه والله عملت yes, I did a tattoo recently. Or he will pick the sexual transmission. Or if she's a female, she will pick something else, يعني the transmission to her, إنه مثلا she get it from her mother. Whatsoever, she will be open to you. And it is not history taking. You enumerate it and you ask her, have you ever had any of those risk factors? Or do you think that you might have got this virus through any of those previously mentioned methods? She will be open, or she will tell you, no doctor. خلاص, no doctor معناتها this is not something to discuss. There is more يعني, or there is other concerns. فهلا you enumerated هذا, this is in the part of the explanation. تمام. هلا in the part of the management you have, this is counseling. So in the part of the management, you will start by, we will determine your status. تمام. And we will try to do some further investigation to decide whether you fulfill the criteria for treatment or not. Third, we will screen you for other similarly a virus transmitted by similar methods that I have previously mentioned. And usually whenever someone has one virus transmitted by blood, we screen for the others. Had a third management plan. Fourth management plan, a notification. If it's not mentioned before, it should be mentioned here. Fifth, general advices. Please, you should make sure to get any tattoo in an authorized places. Clean, hygienic, تمام, in order not to get. Make sure to do any dental procedure, again, in an authorized dental clinic. Please, at the moment, practice protected intimate relationship until we confirm your status and the mode of transmission. Fourth, please don't donate any blood. Fifth, don't share the sharp object like razors with any of your family members. تمام. If she is lady, please, it is be careful that this time is not the best time to be pregnant until we determine the full status of your virus, and until we decide about your treatment, and your pregnancy from now on should be planned. You are done. تمام. يعني this is how you should counsel about a case of hepatitis B recently diagnosed. No transmission mentioned in that scenario. No status, exact status, E antigen positive, S antigen positive, the duration. I don't have enough information about acute or chronic. تمام. So from my point of view, unfortunately بالعادة other scenarios I have better feedback لأنه I attended them multiple times. هذا I think once I read it in Rider before, but this is what I remember and this is what I think يعني you should people discuss.
Yes.
If anyone want to correct me, if anyone want to add, إذا أنتوا قلتوا
No,
المعلومات
thank
وأنا
you.
عارفة سامحوني.
No problem, Dr. Hind. But anyone has the same scenario, please, he can share it. We want to know what's the type of antibodies, for example, they share, how is the status of the virus,
هلا I
because it
remember
will,
that
yes,
many people منهم الدكتورة جيا. if I found the screenshot of that scenario I
okay,
will share it لأنه ما
please,
شاء الله
yes,
عليها جيا she sometimes share complete scenarios بس ما بتذكر دكتور KGI أو حدا أو دكتور أحمد. حتى دكتور أحمد ما متأكدة بس جيا بتذكر مرة عملت hepatitis B scenario. I will try to make sure إن شاء الله ما تكون عملت
yes,
تبع رايدر لأنه أعتقد تبع رايدر everyone have it. بس يعني if she made a new one I might share with you the screenshot, at least you will get a complete idea how the scenario will be there. But let's suppose
yes,
يعني for us when we practice it's good to practice the scenario in its most difficult form.
yes,
تمام؟
exactly,
يعني
yes,
as if I get such a thing which is very vague, so I have
yeah,
to discuss all the possibility and
yes,
I know everything, whether it's acute, chronic, when it's notifiable, when it's not, and I know all the methods of transmission. So I should be speaking, never ever confront a patient. يعني you might lose the whole scenario if the patient told you, doctor, are you judging me because I have this virus? You really
yes,
lost the scenario. You really lost the scenario. لأنك if you were like more, if you were more toward one of those methods of transmission, and you steer the scenario toward that more than the others by mistake, maybe because you were providing more advices about that thing more than the others, immediately the surrogate will really become angry. The doctor, are you judgmental? Are you judging me because of this virus? Take care. Keep everything in neutral. Enumerate all of them as if all of them have equal chance of transmission because you have no information. Okay?
okay, thank you, Dr. Hind.
If he is a healthcare, do you know, asking
Yeah,
about the job in this scenario is a game changer also. If
yes,
she's a lady, pregnancy. If he is a male or female, also the job. Because if he's a healthcare provider, there will be more restriction on his job than if he
exactly,
is handling any other job. تمام? Because
yes,
healthcare provider, they are restricted from practicing medicine until they are like, do you know, their status is confirmed and the transmission is confirmed. Everything is done يعني.
yes,
Take care to ask about the job.
yes, occupation is
And
very important
I
in
think
this,
the job, pregnancy, impact, those are the most important things يعني.
yes,
If she's a male or female يعني. تمام?
yes. Thank you, Dr. Hind. The one question, does it affect the kidney? No, it doesn't affect. It need to be adjusted if there is kidney affection or renal impairment. This is one of the precaution you have to give advice. Okay, let's go to the next scenario. You are internal medicine doctor, Mr. Brandon. Known case of autoimmune disease has been experiencing progressive difficult swallowing, resulting in significant weight loss, recurrent choking episodes, and occasional aspiration pneumonia. The medical team has decided that the patient would benefit from nutrition support via feeding tube and possibly non-invasive ventilation due to signs of respiratory muscle weakness. The task to discuss the following with the patient: the need for feeding tube, either radio, radiological intervention, gastrostomy, or the big tube, percutaneous endoscopic gastrostomy tube. The potential need for non-invasive to support breathing. Okay, let's start now. Dr. Abdulmanam, you are ready?
Okay.
Yes, let's start. So I will talk to the patient or the son because
To the
not
patient.
written,
Yes, to the
not
patient.
written the patient. Not okay. I will ask. Okay. Hello, I'm Dr. Mukhtar, the doctor in the medical unit today. Uh, may I confirm your name, please? You are Mr. Bandon.
Yes,
How old are you, Mr. Bandon, please?
I'm 40 years old.
40. Okay. We are here to discuss about your health issue. Is that okay for you?
Yes.
Yes. Please Do you need anyone with you to support you in this meeting?
No, I'm okay, doctor.
Okay, Mr. Brandon, can you tell me what do you know about your condition so far?
Yes, doctor, for a long time they diagnosed me with this problem affecting my muscle and nerves. And however, recently I have some trouble with feeding, especially when I'm trying to swallow my food. Sometimes I feel choked, and sometimes I have this cough, and sometimes the food come out of my nose. Then I went to my doctor, and now I'm here in front of you.
Yeah, I'm so sorry about your suffering all this time, and be sure that we are here to support you as much as we can.
Thank you.
Mr. Brandon, do you have any idea about what's ongoing or the expectation, what we will talk about today?
Just I want to know how you are going to help me with this problem.
Yeah, sure, you're right, and we are here for that, Mr. Brandon. I appreciate sharing with me all this information. Please, I will ask you if you want me to explain more about the disease or you have a good idea
No,
about the
no.
disease.
The other colleagues they explain to me everything.
Yes, I appreciate that as well. So going to the option of the our plan in your condition because of a lot of choking, we have uh, a decision after sitting with the teams, group of doctors, they are professional in your disease, and they prefer to do for you one of these two procedure. I will explain to you one by one, and you have the right to choose which one fitting you. Are you following me?
Yes, doctor. What's this option, doctor?
Yeah, so the first option is called radiological intervention gastrostomy tube. I don't bother about the name. We are abbreviating it as RIG. Let me
Mm-hmm.
explain to you in few steps how we are doing this tube. I will draw for you, Mr. Brandon. This
Mm-hmm.
is from starting from the mouth and going to the tongue and going down, then to the food bag here. Okay, you can see with me. Is it clear?
Yes.
Okay, let me draw it in better way. Okay, from the mouth, going down to the food pipe, then this is the food bag. We have two options, either to go by camera from the mouth, going downwards to the food bag here, and after reaching here, we can open a light, and from the skin we can open small hole through the skin hole and putting the tube in your food bag. Are you following me?
Yes.
This is called percutaneous gastrostomy tube. As I mentioned, it's used by a camera scan. So the camera will go through your mouth, of course, after being sure that you are fit for this procedure. You don't have any blood thinner, your blood count is okay, and during this procedure, we will be sure that you are not feeling any pain. Are you following me, Mr. Brandon?
Yes, doctor. Is it so, doctor? I'm afraid that is so. I will not feel any pain during this procedure because it looked like a big surgery.
Yeah, I appreciate your concern, and it's a valid concern. We will be sure by using our methods and techniques to numb your mouth, as well as we'll give you some medicine through your blood channel to be sure that you are not feeling any pain after calling the pain doctor. How does that
Okay.
sound for you?
Okay, that's good.
Yeah. The other method, it's called radiological intervention gastrostomy tube. It will be through some radiation and it will be done by the scan doctor. And after also seeing the food pipe through the scan, they will put the tube from your skin to the food bag. Both of them are similar, and as we have benefit from this tube, we have some risk and some unwanted effects. Are you following me?
Yes.
Okay, so one of these complication or unwanted effects, you might have some injury to nearby structure or organs, and we are reassuring you that we have a skilled and professional team. They did this procedure many, many times, and they are professional in it, and the risk of this complication is very, very minimal. Are you following me?
Yes. Okay.
Okay. The other thing, you might have some bleeding, and no worry about that. If we have an action immediately. If the bleeding happen, we can follow up and monitor the area of the bleeding, and you can deal with this. However, it's very low again. Yes.
Okay. So, doctor,
Yes, go ahead.
what's best for me? Can you help me? Which is better in my case?
Both are very similar. The difference is not big between both of them. Both of them you will be not feeling the pain, and the complication, both of them are equal or similar almost. However, it's okay. You can take your time. I will provide you a
No,
consent
doctor,
form.
in my
Yeah.
case, what do you think? What is better?
Yes, between two of these,
Yes.
both of them they are for long
No,
term.
I need you to help me, doctor. Which is better in my case?
Okay, in your case, if you need my opinion, I can refer you to the specialist of these tubes, and you can ask them if which one is favor for you.
Okay,
How that
thank you.
sound for you?
Okay, thank you.
Okay, another complicated or unwanted effect might happen, infection in the side of this tube. Don't worry about that. We will call our specialized nurse. She will let you know about how to deal with it, how to clean it, how to use it while taking the diet, along with our diet specialist. They will give you more information about that. How does that sound for you?
Okay, thank you.
I will give you the consent form. You can read it about the procedure and the complication, and everything will be written. Just need your signature whenever you are agree. And if you change your mind anytime, it's your right to change and to abort the surgery. Is that okay for you?
Okay.
Okay, Mr. Bandon, another option in your state that you
Doctor, I
might
have
need.
one more question.
Yes, sure.
I'm going to be able to eat and drink normally after inserting this tube.
I am afraid to say it's not possible, since the food particle might go to your lungs again, and you might have choking and might lead to infection inside your lungs.
Okay.
I'm so sorry for that, Mr. Ronaldo. Okay, the other thing I want you have any concern so far?
No, everything's clear.
Okay, another concern in your condition, sometimes you have some difficulty of breathing, and because of weakness in your breathing muscles, we have also another solution. It's decided by our team. It's called non-invasive ventilation. Don't bother about the term. It's a machine in which it gives you and the air while you are sleeping overnight to help you to breathe normally all over the night, and you can have good sleep and to improve the quality of your life. How does that sound for you?
No. Okay.
So the mask, it's contain mask and some tubes connected to a machine. We will put this mask over your face, and it will give you the air by gush of air through the mouth, going to the lungs and air pipes. Then you can breathe back from this mask, and you will not feel any discomfort while sleeping. Does that
Okay,
sound
so
okay for
I'm
you?
going to have oxygen by this device or this machine.
Yes, it will provide you with good oxygen to be sure that your breathing and your lungs are okay.
Okay, thank you, doctor.
Be sure that during this time or before this time to be empty bag of stomach bag, I mean, or bag of your tummy. Don't eat before this machine because it might lead to some throwing up and you might have also infection. Is that okay for you?
Okay.
You have other
So,
concern.
yes, for last concern, doctor. After you insert these tubes, either big or rec tube, when I can use it for feeding?
Yes, within or after 24 hours, you can use it.
Okay, thank you, doctor.
Okay, I guess the time is exceed 15 minutes.
It's very, very, very long scenario. Very, very
Yeah,
long
okay.
scenario.
So suppose if one of the procedure I will talk about advanced directive because he's and also last thing about attorney and yeah concerns and that's it. Okay, now your comments.
I think you covered everything for this scenario. Regarding the concern of what's best for me, doctor, in such case of motor neuron disease, because in case of big tube, percutaneous gastrostomy, or endoscopic gastrostomy, sometimes might need patient to lie down, or even might, as you mentioned, that we need general anesthesia or minimal anesthesia, which is might affect his breathing, especially in case of motor neuron disease. So in such case, the best option for him is reg tube. Okay. This the only concern that yes, the only concern that you didn't respond for. And regarding I will refer you to consultant or whatever. Actually, Dr. Basim, I had a negative feedback about this when the patient or the surrogate asked me about something. I told him I will refer you to my consultant. Blah blah blah. So in feedback, he mentioned that the candidate keep referring the patient to the consultant, in spite it was one time. Okay. So regarding the issue of consent, I think the scenario is very long to mention the consent here. And why I said that, because my friend, he just had the scenario on Sharqa. He told me that he didn't mention he didn't mention at all the issue of consent. And in spite of that, he got 15 out of 16. So if you try to mention the full criteria of consent and the consent, I think it's better to say when you decide what the other which procedure better for you, we will arrange another meeting and might need to assign consent. That's it. Because I think the time here is an issue and dilemma, because you have to cover two procedures and additionally to non-invasive ventilator. Regarding the NIV or non-invasive ventilator, so is it oxygen or pressure? So is it pressure will deliver or oxygen? I think it's not oxygen, it's pressure.
Any,
Pressure goes to the lung. Yes.
but any non-invasive machine should be connected to oxygen.
It's not, it is a pressure pump, I think. Air, not oxygen. So
Okay, so home by BAB, you mean? Yeah, home. Yes, it's different than the okay, the
yes,
hospital one. Yes, you're right.
yes,
Yes.
yes. And that's it.
Okay, yes, Dr.
Yes,
Aisha
but
also
it's very,
confirm
very,
it's
very
air.
long
Yes.
scenario.
I think they will not bring such scenario by both
No,
or three
no,
elements.
it's come like
Really?
this in
Three
yeah,
elements? Oh my God.
yes, yes. This
Okay.
I think it's repeated scenario.
Okay,
Big
thank
rec
you.
tube, yes. This scenario come firstly by big rec tube and no, big tube and NG tube, comparison between two, and the other one rec tube, big tube, and an invasive ventilator.
Okay, how I will give him the reference to this over this, or I will say rig better than big.
In your
Why
case,
I will say that? Why?
because
And
of
based on what?
breathing problem. Because in case of percutaneous endoscopic, sometimes might need to give a general anesthesia, or patient should lie down. And if the breathing is
Okay.
affected a lot of, this might cause more compromise with breathing.
Okay.
So
And the rig?
no need for that.
Mm-hmm. So the rig is better for him, right?
Yes,
Yes.
for
Because Mhm.
yes.
Also, we measure the FVC in sitting and lying, and if it's more than 50%, he can go with the PEG. But if it's small, low, we do the reg, because the PEG need the patient to be semi-sleep, or he will have semi-anesthetic, so it might affect his breathing. That's his main concern. That's why we'll go with the reg. But
Exactly.
if the FVC is high than 50%, so he can do the PEG feeding. So we'll tell him that we'll check your, because this patient is non-invasive patient. So I think in this scenario, you will tell him, as he's for non-invasive ventilation, it means the FVC is very low. So I think we will go with the reg, not
Okay, now, yes, got it now. I got it. Okay. Okay, yeah, nice question for Dr. Abdulmenan. Which point you mentioned the point of referral to consultant and they minus you?
It was in scenario of pneumothorax, the pilot that had
Okay.
spontaneous pneumothorax and completely resolved. Yeah, she keep asking me when exactly, and I told her, as mentioned, the scenario just prevent her to go to travel tomorrow. And at that time, I wasn't know when exactly, after 4 weeks or whatever. So I mentioned that I will refer her to my consultant and discuss this with my consultant, and then I will back to you. But they gave me a negative feedback about that.
I guess if you refer to the airline's rules better than the consultant, because the consultant still he is not the one concerned for really. I guess this is it would be much better or make sense. This is my opinion. If I face this, I will not prefer her to consultant, because the consultant the same in position with me about airlines regulations. So
Actually, it's not refer. I will ask my consultant.
okay.
You know,
I
the consultant
Yes.
said to me, he was teaching us for communication. He said, you know why we are asking you to do the PACES exam? I don't know why. He told me, because we don't want you to call us at night
Yes, everything.
and ask
Yes.
the consultant. So I think that if we will say ask the consultant, we won't pass the exam.
Yes, exactly. They don't want from you to call them for every single point, any conflict. So you have to take decision upon your responsibility rather than calling him, unless it's a major thing. But for some details or for them, it might be doesn't make sense to call them for this point. Yeah, why I will call the consultant to tell her about her flight. So for me, if I will say, yeah, I will be referred, or I will review my the airlines regulation, or I can refer you to the airlines guidelines, or they can update you about your travel if I'm stuck. But you know now the duration, right? It's for spontaneous pneumothorax, if he's pilot, 6 week, right?
Yes, 4 to 6 weeks. Yeah.
Yeah. So the scenarios are repeated, and now we can answer this. Okay, thank you, Dr. Abdulrahman, for the practice and the scenario today. Any comments from others?
Dr. Bassam,
Any? Yes, Dr. Azhar, go ahead, please.
you, mashallah, you make the diagram very nice. Can you repeat it? Because I have little bit confusion with these two procedures. This
So
PEG,
the big camera from the mouth going downward to the esophagus and the stomach, and they put light or the light under the skin, and you will make new incision or small incision over the light, and they put
light.
a wire. Yeah, and they put a wire. Then this wire will be in the stomach, and they put the tube over this wire like guide wire. You know the sliding technique.
Yes, yes. So this is PEG, huh?
This is big. Rig, it's fluoroscopy using, but I don't think they put something in the mouth. I don't know how it is.
They
If
put
someone, yes, go ahead.
swallow barium enema, and
Okay.
put it, I think, the tube from the mouth and no. They give him a barium swallow to locate the area that they will put the tube, and then they put the tube from the skin, and after that they will do an X-ray to make sure that the tube in the place with the barium. This is, I think, the reg. The PEG, it is given by endoscopy, as endoscopy from up,
Yes,
and
yes.
then in from down inside. But the reg is radiological guided, so they put a barium swallow, barium meal, and know exactly where they will put the tube by the X-ray, and then they will insert the tube with local anesthetic. But the PEG with as endoscopy with semi-sleep, they give him some medication to keep him drowsy.
Yeah, because of the endoscopy, yes.
Yes.
I will share videos, Dr. Azhar, to the group, YouTube
Okay.
videos, how they can do it, okay?
Okay. Thank you. Thank you.
Most welcome. But in details, don't go through deep details. Just explain lightly, because you will waste time explaining, and maybe he will not understand the details, I mean.
Especially the scenario is very long, so I think they
Yeah,
will.
it's better to go through.
Both of them will make an incision or cut in the tummy wall, and to ensure this tube inside your stomach. I think stomach is not a jargon. Instead of food bag, or I think I'm not sure. However, but I think it's not a jargon stomach. Everyone can say stomach. So to ensure this tube inside your stomach, sometimes we might need endoscopy, which is thin, long tube attached to the camera, and the other, which is called big tube, and the other one, it's through scanning of your tummy to ensure this tube inside your stomach. Full stop. So because the scenario is very long, if you try to explain everything, I think the time will run out.
Yes, yes.
And the
As
middle
what
of the
happened with
scenario.
me. Yeah, this has happened with me. Okay, there is comment. The explanation of rig is wrong. It is done through abdominal wall incision under guidance of wire with a dye, which is fluoroscopy. Okay, let's review the video again, because I am not gastro to explain, and I'm not radiological intervention to know exactly how the details, but let's review it in the YouTube and to know it more. Pre-procedure fasting, yes, all these things, it's optional to mention, but better to mention. Yes, I agree. 6 hours prophylactic antibiotics, it's not necessary to mention these antibiotics. The blood thinning, blood, the admission, blood thinning medication, blood count, the coagulation profile or bleeding profile. Yeah, you can mention a lot of things, but how to focus on what to focus on according to the scenario. Feeding can be started within not after 24 hours if no complication. I face a big tube a lot of times. They start exactly after 24 hours because it's still the healing of the wound. You don't want to hurt the area of incision. So I think after 24 hours, this is what we are applying in our hospital. If someone has policy or guidelines, he can share it. But I don't think less than 24 hours. Why in hurry? Right? To give a chance for the healing of the wound. And makes sense also to wait, not to be hurried to insert the feeding through it. This is my humble opinion. Enclosure, am I need to ask him which one you prefer? No, I don't think. He's the one asked me and I didn't give him answer because I don't know the clear answer. But now I know it. So it's one of the concern you have to know that the big tube need general anesthesia, but the rig will not need this general anesthesia and it's better for him. But no need to give him the option. You just give him the consent and he will decide which is which is which. But if he asks me like this scenario, now I know the information. Okay. Any question or comment?
just non-invasive أعتقد
Mhm.
ال FiO2 هذا عبارة عن setting موجود بالجهاز. ف if we
Yes,
left it like a 21, which is the
the
room
room
air,
air. Yes, exactly.
but we have an option to increase it.
Yes, true.
And يعني I think since if your patient was given a non-invasive, usually the patient is بالrespiratory failure or tachypnic أو بالheart failure بالacute phase. You have, I'm expecting you have compromised oxygen saturation in these scenarios, صح؟ But I think at some points when you are weaning, one of the criteria of weaning إنه your
room air.
FiO2 become
Yes.
at room air. But when you put the
21.
device, I don't expect يعني بالعادة نحن بنحطه أقل patient حطيناه 35 أو 40
Yes.
يعني
Exactly.
وبعدين they wean slowly until it is room air. We are okay now. والrespiratory يلا remove the device. But I think when we put the device, our aim is not only to provide the pressure. Our aim
But
is to provide pressure and oxygen. And then one of the criteria to remove is when the FiO2 is on the room air, the patient is not tachypnic, or his ABG is fine, he's able
yes.
يعني, to manage without the device. So I think يعني, whenever you will describe the device, you can say that it's a kind of a pressure plus oxygen according to your need. Because يعني, this is more يعني better describing the function of the device.
Suppose his lungs is intact, so he need only just pressure. But as you're right, sometimes they need oxygen. But if
According
he
to
is
the
okay,
need يعني انت
yes,
describe your
agree,
device.
yes,
Yes, no, we will provide you a pressure and oxygen
yeah, yes,
according to
agree,
your need.
exactly,
تمام?
yes,
And until we will find your values are in the range, desirable range. يعني أنا I will provide according للrange. متى ما شفت desirable I will modify. فit make more
exactly, yes,
sense يعني than
yes.
mentioning إنه I will just like give a pressure.
Maybe as
يعني I
mentioned,
don't know, but I felt like this.
you
And
know,
you should.
as mentioned by Dr. Basim now, that to assume this gentleman, because the disease of gentleman is affecting the muscles only, so there is no problem in the lung or in the perfusion or in the ventilation. So because
Yes,
of the
Exactly,
but
weakness
yes,
of the
but
muscles, he need pressure only. And what we are telling the patient, it is not the initial stage. This is long-term treatment for him, as he will go home with this device. So the device for home, this device is for home to assist and to tackle the weakness of the muscles. So it is mainly pressure, as Dr. Basim said, I think.
I
yeah,
agree
yeah.
with you that it's
This
a
is home
kind
by
of
bed,
pressure.
but hospital by
Yes,
bed different. Yes, you're right, Dr.
but
Hind, yes.
I think
I mean
usually those
in the
patients.
scenario. Now we are talking with a specific patient with specific medical problem to tell him that what we are doing for him to help him. This patient in particular
can I
has
say something?
this
Do you
patient.
know
I
how much
just let me
oxygen?
complete. Let me complete. Sorry for that. This patient in particular, okay, we must to speak to him to tell him what we are going to do for him. So this patient has muscle problem, and what he needs pressure only. So I think, for the sake of the exam and the particular case, I will tell him what he needs. I am not talking about general non-invasive and its indications. I am talking only about this patient, what is his problem and what he needs. You can.
Yes, I agree with you, but you don't know his SpO2. Right? And I think one of the clues
this details
in the
will not reach to
LCC.
this details, Dr. Hind.
And I agree مشان هيك أنا قلت لك since
Yeah.
there is no details, so you
Yes,
cannot assume. هلا أنا هل حأستخدم بس البريشر فانكشن ولا حأستخدم البريشر والأكسجين؟ I don't know. Right? So I will mention to the patient that I will correct your values. If the values need pressure only, I will give pressure only.
yes,
If your values need pressure and oxygen, I will give, because usually one of the clues for the LCC لما بيحط لك ال SpO2 واطي وبيكون
we
عندك
have to provide
neuromuscular
oxygen.
disease مثل مايثينيا
Yes,
جريفز، واول كلمه بيقول لك مانك شايف ال SpO2 واطي، فانت you are usually having such affection of the vitals as a part of the neuromuscular affection. فأنا هون I agree with you, it's a muscle problem. But is it mandatory if it is muscle that I will have a normal SpO2? It's not mandatory. And I have a device which have a certain function and I know its function. خلص I will offer all the functions والservices تبع الdevice according to the need of the patient. Why I assumed only he need a pressure? What if he need high FiO2 يعني?
Yes,
get
better
me?
to keep it according to his need. Yes, that's
According
enough.
to his need, I will offer him a pressure and oxygen through this device according to his need until he achieve the desirable values. If he need oxygen, if he need only pressure, يعني at least
Yeah.
this is what I think.
Yeah, this is diplomatic answer. Yes, I agree for this also. But most of the non-invasive or home bypass doesn't connect to oxygen. It's just room air. Anyway, we'll not argue about this point. It's variable from patient to patient and from condition to condition. Thank you, Dr. Muhammad Mustafa and Dr. Hind, for the opinion and discussion. Machine blowing air, yes, through mask, through nose and mouth, agree. In order to explain the patient, it is machine which deliver air with pressure. The main benefit of the machine is deliver pressure. Whatever, it supports his breathing, that's it. Either pressure or air. No, don't go deep with this details with the patient. Okay? Even if low oxygen, just pressure, it will be corrected as usual with pathology. It is not COPD. Yes, I agree. So it's by default it's supposed to be by pressure only without oxygen. But maybe he had aspiration and the aspiration affected his lungs. You don't know. So no need to go through all these details. BiPAP and CPAP itself stand for positive air pressure. Yes. Okay. Thank you. Yes, right. Okay. Nice communication day with the hot discussion and a lot of comments. Thank you for the interaction today. I noticed a lot of comments. What's helped all of us. And always, please, whenever you feel any conflict, share with us. If you feel you want to practice, also share with us. Hopefully to learn more and to be confident in their communications. Communication need only to be talented, how to talk, how to convince, how to answer and to address the concern. Okay. Thank you everyone. Thank you, Dr. Manel, for the practice with me today. Thank you everyone sharing with us the comments. See you tomorrow inshallah with another clinical day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
عليكم السلام.